Why is ECT considered a last resort for bipolar? Imagine facing a storm that just won't pass, no matter how many umbrellas or raincoats you try. That's often how severe bipolar episodes can feel for some people. When standard treatments like mood stabilizers and therapy don't bring relief, doctors might consider a different approach. That approach is electroconvulsive therapy, or ECT. While it's highly effective, it's usually reserved for the most challenging cases. So why is that? Bipolar disorder is typically managed with medications such as mood stabilizers, like lithium or valproate, and sometimes antipsychotics. These are the first options because they are less invasive, have well-understood side effects, and can be administered in outpatient settings. Most people respond well to these treatments, which makes them the go-to choice initially. Electroconvulsive therapy involves passing controlled electrical currents through the brain while the person is under anesthesia. This causes a brief seizure, which helps regulate brain chemistry. ECT can rapidly reduce severe symptoms like intense depression, mania, or mixed episodes that don't respond to medications. It's especially useful in emergencies, such as when someone is at immediate risk of harming themselves or others, refusing to eat, or experiencing catatonia. However, ECT is considered a last resort mainly because of its potential side effects. Even with modern techniques, some people experience temporary memory loss, confusion, or disorientation after treatment. Serious complications are rare, but they can happen. Because of these risks, doctors prefer to try less invasive options first. Also, ECT requires general anesthesia, which carries its own small risks, especially for people with certain health conditions. Timing is another factor. Some clinicians prefer to wait months or even years, trying multiple medications before considering ECT. Others might recommend it sooner if the situation is life-threatening. Delaying ECT in severe cases can prolong suffering and might reduce its effectiveness, so the decision is always tailored to the individual's needs. It's worth noting that attitudes toward ECT are changing. For some severe cases, especially when rapid relief is needed, experts suggest that ECT could be considered earlier rather than later. But most guidelines still recommend it as a backup when other treatments have failed. In summary, ECT is considered a last resort because it's generally used after less invasive treatments have not worked or in urgent situations. Its proven effectiveness in severe, treatment-resistant cases makes it a valuable option, but the potential side effects and the need for anesthesia mean it's not the first choice. Always, decisions about ECT should be made with a healthcare team, considering the person's unique circumstances. If you or someone you know is dealing with severe bipolar symptoms, talking openly with a mental health professional can help explore all the safest and most effective options available.